Welcome to SLP Nerdcast, your favorite professional resource for evidence-based practice in speech-language pathology. I'm Kate Granbois.
And I'm Amy Wonka. We are both speech-language pathologists working in the field and co-founders of SLP Nerdcast.
Each episode of this podcast is a course offered for ASHA CEUs. Our podcast audio courses are here to help you level up your knowledge and earn those professional development hours that you need. This course, plus the corresponding short post-test, is equal to 1 certificate of attendance. To earn CEUs today and take the post-test after this session, follow the link provided in the show notes or head to slpnerdcast.com.
Before we get started, one quick disclaimer. Our courses are not meant to replace clinical advice. We do not endorse products, procedures, or other services mentioned by our guests unless otherwise specified.
We hope you enjoy the course.
Are you an SLP or related professional? The SLP Nerdcast Unlimited subscription gives members access to over 100 courses offered for ASHA CEUs and certificates of attendance. With SLP Nerdcast membership, you can earn unlimited CEUs all year at any time. SLP Nerdcast courses are unique, evidence-based, with a focus on information that is useful. When you join SLP Nerdcast as a member, you'll have access to the best online platform for continuing education in speech and language pathology. Join as a member today and save 10% using code NERDCASTER10. A link for membership is in the show notes.
Hello, everyone. Welcome to SLP Nerdcast. We are really excited. We're always excited for our episodes, for our recordings. However, today's episode is about a topic that is very near and dear to our hearts, both Amy and myself, talking about working with complex communicators as they go into their teen and adult years. We are very excited to welcome a content expert here with us today to teach us everything she knows. Welcome, Deirdre Flores.
Hi, thank you for having me on the podcast today.
Thank you so much for sharing your time with us today. You're here to discuss empowering independence, teaching and fostering effective communication skills for adult success. But before we get started on our topic, can you just tell us a little bit about yourself?
Sure. So I am a speech pathologist in Westport, Connecticut, and I have worked with teens and young adults my whole career. So in public schools and in private practices. I am the owner of a private practice called the Teen SLP, where we run groups focused on the communication skills that teens and young adults need to be successful post-secondary, whether that is after high school, going to college, going to work, volunteer, going to a transition program. So what are the skills, communication and social skills that they need to be successful and independent in the adult world? In 2021, I started my private practice because I saw that after public school, so either 18 or 22 years old, when students leave the public schools, there's a big service gap that they are expected to enter adulthood with these skills. And if you think about it, the clients that we see previously, like right when they're 18 in public schools, they have speech therapy because their language disability affects their ability to get the language skills needed for those environments just by being in the environment or observations, right? They need explicit instruction. But once they exit high school or they exit the public schools, it's expected of them to become an adult and then suddenly take on all the communication skills you need to be an adult just by observing and being in the environment. Where we know as speech therapists that individuals with language disabilities really benefit with that explicit instruction. And I think Autism Speaks has a really staggering statistic where it's 50,000 individuals with autism exit high school every year. So that is a huge population, and that's just autism, right? As speech therapists, we treat a variety of clients that have a variety of different diagnoses, whether that be auditory processing, pragmatic language, attention difficulties, social anxiety. And so there is a huge group of teens and young adults that benefit from support and services so that they can lead more independent and successful lives. And we as speech therapists have the tools that can help them. And so that is what I do at my practice.
That's awesome. Thank you for sharing that. We here in Massachusetts, just here in Amy and our area, we see this a lot. Just the lack of supports that are available for these families as they age, everything from day hab access to residential access, depending on what a family, an individual family's values, goals, wishes are. So this is an incredibly important area. The infrastructure, unfortunately, is just not what it needs to be, not what it should be for these families. And I'm excited to learn about our role and what we can do as clinicians to help improve that. So I want to start by reading our learning objectives. For today, after listening to this episode, participants will be able to self-report knowledge gains related to client-driven goal setting and explaining its importance in fostering independence for neurodiverse teens and young adults. Participants will also be able to self-report knowledge gains related to social and communication skills essential for success in adulthood, including self-advocacy and perspective taking. Participants finally will be able to self-report knowledge gains related to tools and strategies for implementing effective group therapy sessions for neurodiverse teens and young adults. Anyone who is interested in learning about or reading about all of the financial and non-financial disclosures for this course, that information is located in the show notes, as well as on our website. If you are interested in earning ASHA CEUs for listening today, the link for that will also be in the show notes and on our website. And without further ado, I am excited to kind of get into the meat of this.
Yes. So the number one thing that's important when working with young adults is that they want to be there, right? So I feel like for their whole lives, they've gone to speech therapy either because they've had an IEP or their parents say this is really important. But now as a young adult, it is important that they want to show up, that they are identifying that this is an area that I want to improve on. Self-determination is research has shown is one of the key factors to show that predicts if you're going to be successful as a young adult, right? To make your own goals, to figure out a way to achieve them and to work on them. A lot of my clients are referred to by their parents or outside providers, but where it starts is like my intake process. So I start off with a conversation with the young adult, and we kind of go through like a checklist of communication skills that you need to be a young adult. So like we were saying before, problem solving, self-advocating, conversations, which leads into friendship skills. And we kind of go through all of these, and the young adult will say like, yes, I do want to work on that area, or no, I'm good with that. And then from there, I'm like, okay, great. So I either have a group or we can work individually, and I could help you with those skills. That is really important. One, because of motivation, right? Now they want to come see me because they see the value of it. If they're going to be in a group, it's really important then that they're an active participant. And I always link it to when we want to be healthy and we go to, let's say, a trainer, and you meet with that trainer for a half hour a week. And if you're really not bought in, and then you don't do anything, and then you meet with them again the next week, you don't really improve, you don't practice outside. But if you really are motivated and this is your goal, you're going to meet with that trainer, then maybe you're going to go to the gym the next day and practice what they taught you, and then you're going to start to see improvements. And so the same with like speech therapy, especially as an adult. You go in, you meet with me, we meet, we come up with a plan, and then they carry over those skills outside of therapy. And I think that's the number one thing as a young adult, like, let's be bought in, and I will help you with tools and strategies, and then you practice outside, and that's how this is going to be successful. And again, that ties into that self-determination, the goal, making a plan, and then following through.
In order to get there with your clients and get that sense of buy-in, I have to assume that you're spending some time establishing trust.
Yes. Yes. So establishing trust, even just going through conversations around these skills, you really get to know their thought processes, and they do become really vulnerable with you, right? And that you are like, I can help you. I have some concrete skills that's going to help you feel more independent and help you feel more successful.
how do you navigate instances where you're working with a client, you're going through this checklist, you're really trying to learn about their individualized values, their individualized goals, and you hear the voice of their parents sneaking in, right? They might may not have spent the time thinking about what they want because kind of been constructed to think, oh, well, you should. This is one of my new favorite phrases. Nobody likes to be should on. Okay, right? So how do you navigate it when you get the impression that they are shoulding, right? They should do this and they should do that. And there's the voice of the expectation, societal expectation or parental expectation on their future goals. How do you
Yes.
navigate that?
So a lot of it isn't just like, do you want to work on this skill? I also present it as like thought processes. So sometimes I think, or sometimes I feel really nervous when I go into a new situation and I can't start a conversation. So I don't present it just like, I have a hard time starting conversation. Sometimes I think this to myself, and I feel like they connect a lot more with when you put out, are you thinking this? Is this a thought process? Also, I will put it back on them of like, oh yeah, I should do this. Okay, so explain to me, what will that look like? And what will that do for you? How would that make you feel happy? So kind of bringing it back to them and the value that it is for them. And sometimes they'll say, oh, I don't know. Then I'm like, okay, not as valuable for you as maybe for your parent. And if you're coming to see me, I want to know what's valuable for you. What's really interesting is a piece of being an adult is dating, right? Making connections is really important. It's one of my favorite pieces of running groups. So I have like a specific group on dating, and I have an adulting group that we go over dating. And a lot of parents, when I talk to them on the phone, they're like, oh no, my son's definitely not interested in it. And I will tell you 9 times out of 10, I go into the dating piece and they're like, yep, that's exact. And then all of a sudden you see them, yep, I want to be able to have a conversation with someone I don't know. I want to be able to ask them for their phone number, plan a hangout, right? Understand nonverbal body cues. Like dating is all communication. And so it's like, that's it. That's exactly that's what we're gonna work on, because that's important to you.
Can you talk to us? Sorry, Kate, I'm jumping in.
No, all I was going to say was the audience can't see me like beaming from ear to ear with smiles over the idea of working on dating.
Yes.
I just love that because love is love is love. And how wonderful to give someone access to experiencing that as a young adult and making sure that that opportunity is there for them. That was all I was going to say, was just joy. That's it.
Thank you for sharing your joy.
You're welcome.
I had a question thinking, because you said the relationship section, and I was wondering if you could talk us through a little bit kind of more about the structure of what that intake looks like. Is that something that you've designed yourself? Is that something that is like commercially available for SLPs who might be listening? Because as someone who works in the school system, my older students, I'm always on the hunt for nice assessment tools that help us look at all of those components of social communication in particular, and like adult communication skills. So I just was hoping to learn a little more about that.
Yes. So it's actually, I created it myself based on like a whole bunch of different research and books that I've read and went through. And again, from the speech side, and then a little bit through the psychological side, right? So you are going through the thought processes. And I break it down into the areas of being an adult. So problem solving, perspective taking, self-advocacy, job skills, higher level language, and then dating. And then when you're thinking of a young adult, you also need to think of like the different environments that they're going to be in. So environment could be work or volunteering, right? One or the other. School, if they're going to college, or if they are going to a transition program, there still is a little bit of school environment in there. A big piece we talk about is dynamics within families, because they are wanting independence. So that self-advocacy may be advocating to their parents that they now want to choose when they're going to the dentist and make that phone call. And then in the community, so driving and problem solving, a little piece of my groups too is we do outings. We go out and go in the community. And just recently we went out to the mall, And it's a really big mall, and there's all these different entrances. And I had a client that drove himself, and he just parked, came, met us, and then he totally forgot where he parked his car. And so we talked about that kind of problem solving. So and that's like problem solving within the community. And then when you can't find your car, right there, it's communicating. So it is looking at the different areas of communication as an adult, and then the different environments that young adults are in.
I wonder, I mean, as you were talking, I was thinking about just the family systems piece and how counseling, I mean, we talk about counseling. I think every single episode on this podcast, counseling touches everything we do in speech pathology. But when you are thinking about or talking about advocating to their own parents, you're really starting to, especially if they're technically a minor still, right? So if you're working with someone who's maybe 17, or someone who's over 18, but there's maybe questions of guardianship or, independent living, then the parents are going to be involved. So how do you navigate that from a counseling and family systems aspect in working with the whole unit, the whole family unit?
Yes. So every month, along with billing, right, I send an email to the parents about what we've been working on. So I might send a visual of a strategy we're working on, and then I talk to them how their young adult is doing. That is where I can say, hey, Sarah has been working on really self-advocating for herself or planning, and she really needs to choose at least 2 appointments she's going to call and plan for herself. I know that she gets her nails done every month, and she said she has to go to the dentist. Can you please, you can support her, but she really needs to do this month. I have parents come up to me and said, I needed that. I needed you to tell me to back away. And so kind of using it as she needs to practice this in real life, and please let her do that. I'm here to support her, but I need you to take a step back. And so I use that opportunity to say, kind of like the homework piece, right? But I can't imagine parents, it must be so hard. You have somebody with a disability that's navigating adulthood, and you are so nervous. This is new for you too. And so it is nice that we get to be that role of, don't worry, let her be a little bit more independent. I'm a stopgate, and then somebody else, then we could call you in when we need it, but she can practice this on her own.
I was just going to I was smiling while you were talking because a lot of this resonates with me personally as a parent. Maybe this is an overshare, but it is hard to be a parent. It's extremely hard. I'm a parent of a teenager. As a matter of fact, today is her 14th birthday. So happy birthday to my child. But it's really hard to let go as they get older. So these parents that you're working with are also on a personal journey of their own parenting experience and their own parenthood. And it's hard to let go as your kids get older. And it's even harder, I would imagine, if you've given, if you've had extra anxiety and extra worry about making sure that they have everything that they need, that they're going to be okay, that they can do things on their own. So there's a whole complexity of individual journey and growth there just for the parent. And I think it's worth pointing out, mostly because as therapists, it's really important to take the lived experience into consideration when we're putting our counseling hat on, right? And I think I'm reflecting on myself as a younger therapist. It's so easy to be like, well, just don't do that, or do your homework, or just go take this and do it without consideration of what that family system feels like for the parent and the care partners.
Yes. And to go back, right? Think about it. They went through school and they were taught how to school, and there isn't really explicit instruction in how to be an adult. So the parents often are teaching them how to be an adult, right? To make those phone calls or to navigate, and they have a lot on their plate. And so it's kind of like, hey, I'm here. She is going to learn this skill explicitly through, right? She knows how to do it. We have practice in a safe place. She can do it. And I think it's a lot on parents' plate, but to offer these groups really helps those parents realize, yes, they have been taught and they have the skills and they practice these adult skills to be independent and to be successful. So that's why it's so important that we do provide these services.
Well, we've been talking a lot about this, the skills and the counseling dynamic. I wonder if you could tell us a little bit more about the process of setting the goals themselves, right? Obviously, a lot of that comes from your intake and going through those different category areas. But once you've done that with a client, what does that process look like in terms of collaborating together to come up with goals that are going to be meaningful for them and impactful for them?
Yes. So from that intake, we kind of prioritize which 3 to 4 are the most important. Now, that's like if I was doing individual therapy. I offer a lot of groups. And so one of my most popular groups is called Adulting. And the first session of the group, I've done it a variety of different ways. I've handed out kind of checklists of these are the areas that I want to work on. We've done something fun like a Kahoot, and we've taken a survey. So like, here are the areas, which ones are we going to work on first, and it is within the areas, it's a 12-week group. So we target each skill, but which one is prioritizing? Like, which one should we go first? So then from there, right, we want to work on it almost always is conversation skills first, because they're always like, I don't know what to talk to people about. So let's say we do conversation skills. We'll work on those strategies. And within it, I don't just put conversation skills. I'll break it into, starting a conversation with somebody you don't know, keeping the conversation going, asking someone for their phone number. So I'll break it down into skills. They'll identify which ones are important to them to work on. And then we'll work on those skills for, let's say, 3 to 4 sessions. Then I'll re-enter that intake, that checklist again, and then say, okay, let's realign. What do we want to work on? And they will then mark off what they want to work on. And what is really cool is that they'll see that from 3-4 weeks ago, they really wanted to work on, let's say, starting conversations. And now they're like, no, I got it. So now let's move on to asking someone their phone number or advocating for myself. Again, going back to like the gym analogy, it's like when you first start working with your trainer and you're like, I just want to run for a mile. And then you're working on it. And then like 4 weeks later, he checks in and he's like, all right, run a mile, and you do it and it's easy. So that's why I like, it's like those check marks. So then by the end of the group, hopefully we have gone through all of the skills, or we have addressed a lot. And now they have identified, yeah, you're right. I can start these conversations by myself. I am advocating a lot more at work by on my own. So the goals are in a group are kind of ever changing, individualized in the part of, let's say we all say we want to work on starting conversation or maintaining conversation, different strategies. One person may always need to look at the visual. One person may need a little bit more prompting. One person might be able to do it right away, but let's see if they could, change the topic mid-conversation. So that is where the individualization comes in. So it's like one strategy kind of could be the umbrella, and then how each individual is able to achieve the overall goal through that strategy based on like cueing and what supports they need.
You just touched on a question I was going to ask, which is around group cohesion. I'm like thinking back to my outpatient days more than 15 years ago at this point, and thinking about the challenge of creating groups that are a good fit, where there's good, already used the word cohesion, but there's a good vibe in the group, right? Everybody's getting something out of it. What strategies do you use to facilitate cohesion? Is it selection, or intentional people, choosing people intentionally for a group? How do you go about navigating that?
So the number one thing is the intake is that they're motivated to be there. So they all want to work on the skill, right? So you're showing up. I also tell parents, I'm not a friendship maker. I'm not a matchmaker. I'm here to teach them a skill. We will practice, and then hopefully they'll apply it. My groups have turned into friendships, almost all of them. There's group chats, they hang out outside, but that is not my number one. That is just a bonus that happens. So they're motivated to be there is number one. Then, right, the first 1 or 2 sessions, you can see people have walls up because this is hard. I often start off with I'd say like a social opener, which is almost like a conversation opener, but they don't know it's a conversation opener. So like a would you rather. Let's say it's summer right now when and so would you rather go on a roller coaster or a water slide? And then, they all share, and then it's like, oh, have you ever been to? And I might share a water park in Connecticut, and then start the conversation and see who has something, that they share in common. Often they're around the same ages. And so I love nostalgia. That is like, right? You bring up nostalgia, somebody's walls just break down and they want to talk about their childhood, right? What makes you were so happy, like the toys you played with, the cartoons you watched. So I will find like on YouTube, like name that cartoon, and I'll put the years that they were born. I just had a high school group and they were born in 2010. Like, oh my gosh. So
This is
nostalgia,
horrifying to me.
I know. So nostalgia of 2010. And so you could just see the wall. Oh my gosh, I love that video game. I love that cartoon. Me too. By the second, third session, we are all on the same playing field. We are talking. We found out things that people have in common. And that's a part of my role as a facilitator, right? Oh my God, you both play video games, right? Have you played this one or that one? And so that is a little bit part of the role that the speech therapist plays to make sure everyone makes these connections. But involving some fun, interactive activities like that really helps mesh group.
Do you also tend to select groups based on we talked a little bit earlier, you were talking about the different environments that people are in. So do you have different groupings based on like students who might be in their early 20s but are still attending school versus people who are attending their high school versus students who are in their 20s and are attending college or working at a job site? Do you try and pick like environments?
Yes. So before the intake is the conversation with either the parent or the provider that's referring them. And I will typically describe the participant that might be in my adulting group. So in my adulting group, often they'll drive themselves, right? They might be volunteering or have a part-time job. They are looking for friends actively. They are saying, I'm lonely, I want friends. I have a mastering conversation group where it might be for someone that needs more prompting just to engage in conversation. So there's a different profile of clients, and I will direct them to which group is appropriate. I run a group that's called Campus Ready, and so it's for seniors going onto the campus, and they're just working. So they've been accepted to college, right? They're graduating, and we're just working on how do you problem solve with your roommate? How do you self-advocate for those accommodations? So I guess before the intake, it is the conversation with the parents or the provider to then say what is appropriate for them.
That makes a lot of sense. I wonder if you can tell us a little bit about how the skills that you target for in conjunction with your clients might look a little different depending on those different groups. And so thinking about the difference between those clients who might be, still attending, they might be in their early 20s or late teens, they're still attending their public school versus those who are attending, getting ready to go off to college or working at a job. I was wondering if you could tell us a little bit more and give us an example of how, we might work on skills like self-advocacy or perspective taking and how that might look different across the different groups that you're running.
Yes. So perspective taking. So in my conversation group, we use a lot of perspective taking about how you might start a conversation based on somebody right? So you stop and you think about that person, what's a topic we share in common, and I might bring that up. Perspective taking in the college group may be tied to problem solving. So it might be, what do you do when your roommate is bringing people over and late and you want to study? Or maybe it's reverse. Maybe you have the lights on and you're playing video games till late at night and your roommate is trying to go to bed. That's perspective take. I do a lot on problem solving, perspective taking together, kind of using I statements. And the first is recognize their feelings. So I realize that you are frustrated that I'm staying up till 2 a.m. playing video games. but I need to, right? And then to advocate for their needs. In the adulting, perspective taking, we talk a lot about perspective taking via text messages. So how would the other person feel if they got that text message? So, right, tone of voice, we add emojis all the time for tone. And so how might that other person receive that text? And then also a big piece is ghosting. My clients don't mean to ghost their friends on texting, but they just don't know how to keep the conversation going. So I give a strategy of like, send a meme or a picture of something that's, that you two share in common, or that they will think is funny. And they'll be like, well, I feel uncomfortable doing that. And then I'm like, think about it. If you received that text, you would be like, oh my gosh, this is so funny. I love this. So the perspective taking isn't always that you did something wrong. It's like, well, what you're doing will also make somebody else happy. And so that's why we'll continue the conversation through sending a meme or a picture or checking in. Hey, how was that interview you went on? So perspective taking is a skill that we do all throughout the ages and all throughout different levels.
I love the idea of what did you call it? A GIF? GIF? I never know how to
Yes,
say that.
I know. I don't
I'm
understand.
dating myself here. I've already disclosed I have a teenage child, and now I don't know how to say or describe modern technology. That's fine. We're going to move on. But I love the idea of that because, as we know, visuals are powerful in therapy. How else do you incorporate visuals in your sessions, in your groups?
Yes, all the time. So when I talk about strategies, there's always a visual that's attached to my strategy. So it's broken down and it's a visual. So that, again, like I said, if I have to scaffold within a group, one person may have the visual in front of them that has step by step, so that they just breaking it down, taking the mystery out of, right? If you're self-advocating, I have the 3-step process of, state your problem, how you've tried to solve it, how the other person can help you. So we use visuals there. Other visuals, like I was saying, when we start out, I do those activities of would you rather, or kind of watching the video of nostalgia. Visuals just drive, right? Like people are really motivated with visuals. Sometimes I'll pull up some clips I find on YouTube. The generations that we are treating, they go to YouTube all the time. So that's motivating to watch a quick clip on somebody, doing something on YouTube, maybe teaching how to start a conversation on YouTube. And I'll use those kind of small clips as well.
I'm just thinking about how this is similar, but but different than our traditional speech therapy session, right? So in a traditional speech therapy session, we would use visual supports as you're describing, but there are other strategies we might use as well, like prompting or modeling. What other like classic therapeutic strategies are you bringing into these groups?
Yes. So like I said, the visual, prompting, we could have the visual down on the table and I'm just pointing to the next step that they need to do. If we do role play, sometimes we coach the other person with giving cues for nonverbal so that they can respond to those nonverbal cues. So it's kind of scaffolding, different, pulling away the scaffolding, but in a naturalistic way. One strategy, and I guess it's kind of like prompting, is that a lot of the young adults will then bring in experiences that they're having outside of group to bring to group and ask questions. How would they deal with? And I see that as like you've tried it independently, and now you're coming here, and we're going to break it down and practice within a safe situation. For example, I had a client that met up with a friend for lunch. She was going to Uber home. The other friend was driving themselves. She went and waited for her Uber. Her other friend left. Just so happened that Uber took 30 minutes and she felt really nervous that she was left alone for 30 minutes in a place she might not have known as well. And so she brought that to group. And so if you think about it, right, that's like the independent try. She tried that independently. She brought it down to group, and now we scaffold it. We talk about perspective taking. We talk about problem solving. So it is a little bit less of like the traditional go from a visual to a verbal to a nonverbal, and more of like, as an adult, you've tried it on your own. Here are some supports and here are some strategies you can use.
I wondered if you could talk to us just a little bit about, I know we had chatted a little bit, you shared some notes with us in advance, just regarding some of that shift in responsibility back. So we talked about the shift where, you may give somebody homework to make some of those appointments on their own. Is that also true for how they interact with you in terms of like their appointments or any of that? Like, is that also an opportunity to work on some of that independence?
Yes. So my number one thing is, right, I have the initial phone call with the parent often. Then from there, within the conversation, I say, please share my phone number with the client. They need to call or text me if they're not going to make group, if they're going to be late, if they need directions. Right now, bosses and supervisors give out their phone numbers all the time. So texting now has not only become that you're doing it with friends and family, you're doing it with bosses. I know like some doctors' offices, you're texting. So texting now is more formal, right? And you're texting with a variety of different people. In my group, I have tried group chats as well as there's an app called Team Reach that we have used too to do text messaging. And there, I have gotten a lot of practice, like they have gotten a lot of practice on using strategies that we've talked about. So sending a picture of your dog, right, and to initiate the conversation with everybody. So in that piece that you can model what's a group chat and how do you respond. And then what's really cool is a lot of my clients within the groups have then gone to other group chats and created their own and then initiated hangouts outside.
No, that's awesome. And that's such a good point about texting. It really has become, I mean, I literally just this morning got a text from my dentist about
Yes.
scheduling my dentist appointment. And the group chat and connected with that, like group emails are such a workplace piece as
Yes.
well. Like, do you reply all? What do you put in your
Mhm.
reply all message? How do you double check to make sure that you're not replying all if you don't intend to? Um,
And please put a subject line in your email. And I always think, right, when they're younger, we talk about what's the main idea? And that's all I say is like the subject line of your email is the main idea. So it is very speech tied. It's just all practical pieces. It's
Yeah.
like, what's the main idea? Put that as your subject line. You need to greet somebody. The three pieces of an email.
I guess I had never really considered the power of text in a professional setting until you said it, but I'm thinking like Slack or, Google Chat. I mean, I can't remember the last time, and there's so much remote work that's happening,
Mhm.
and the nuance that goes into that from a written language perspective.
Yes. Yes.
That's huge.
And the keeping a conversation going via text messages and what do you do? And I another piece is when you meet two people, right? And a lot of my clients are looking for friends. I have modeled how to initiate a group text. So I might say, "Hey Sarah, this is Kelsey. I wanted you two to meet." And then so I'll have a text where they meet each other and then they might have their own text. Then a client came to me and said, I did it. I did exactly what you did. I hung out with like so and so from one group and another from my like house, and I did the text just like you did, and I introduced them, and then we all hung out. And I'm like, yes,
That's amazing.
yes, yeah. So it's like real life practical social skills, but it's on a device.
Yeah, I love it. And it's like technology is such a ubiquitous part of our life now. And that is how we connect with other people. And being able to make those connections is the first step of having that relationship. I think this sort of ties in nicely into another piece that you do in your work, which is work in the community. I know you mentioned the
Mhm.
trip to the mall, but being able to practice those skills. So, okay, so I've connected with my group and we're going to make a plan, but knowing how to sort of execute that plan. I was wondering if you could talk us through the steps that you might use to teach, depending on any of your groups, but how your level of support may look as the SLP who's facilitating the group
Yeah.
when you're doing these types of community experiences.
Yes. And so when we talk about prompt level, right? My my planning of these community events goes from me doing the most amount of work, so the most prompting, to the least. So as the group goes on, I'm doing the least amount of work. So that's kind of like the prompting right there. So in the beginning, we talk about friendships are based on shared interest. So we talk about in the group, what does everybody like? And let's say trivia night. We went out to one night for a trivia night, but I brought it, said, hey, this place is trivia night on Wednesday. Would you guys like to go? Okay. So here, and again, I followed up with it in a text message so they could see how you invite. I planned what time, what day, where we're going. Then a lot of times in my adulting group, we start off with what's going on in your communities. They're from different towns. And just looking up what's going on, what would you be interested in? Some of them are into meetups, some are not. But the community, there's so much going on, right? As a young adult, you could find based on your interests. So then I will maybe give 3 options. Which one should we do? And then they'll choose. By the end of the group, it is them sending out, at least one of them, sending out a text message in the group saying what, giving an option and asking, do you want to do Saturday or Sunday and what time works best? I have had one session where there were 2 clients that were able to make the group and 3 that weren't for some reason. And they were doing real-time texting. Oh, what should I say? Okay, I'm going to text. Oh, she responded. What do I say back? And so you're able to kind of coach them along with planning a hangout that way. But yes, so it goes from me planning it, every detail, to then at least then them planning it on their own.
So we've talked a lot about texting, the role of technology. We have, how technology is just it's an integrated part of our lives. How else are you embracing technology in a way that facilitates social interaction instead of, what I'm always telling my kids, like, get off your phone, put your technology away, call your friends, How are you integrating technology in a way that facilitates social interaction as opposed to inhibiting social interaction?
So it's really exciting. I have been using a lot of virtual reality and AI tools for role play within my sessions. So these young adults often have had speech therapy for many, many years, and it gets boring, right? And so how do you keep it fresh and new for the young adults? And so I have been working, some are kind of like prepackaged scenarios. Some are that I am able to create them and it's much more tailored to the specific client. So interacting with avatars, some are just on the computer, some are actually on the Oculus, and interacting with AI. And what I really like, the AI, I guess you could call them chatbots or avatars, is they have real naturalistic back and forth conversations compared to when you're role playing statically in a therapy room. I'm very nice. I might not give in. But for example, we were doing a role play, a problem solving role play for my Campus Ready group. And we were saying, okay, the avatar is your roommate and you are telling him he's bringing people over all the time and you need your time that he's not bringing people to the room. Well, I'll tell you, that avatar did not give up and was pushing back. And I was able to coach my client to speak up for himself and really engage in that conversation and really engage in that problem solving and self-advocacy. And they really enjoy these role plays. There are some virtual reality and AI scenarios that us as therapists can really control, like the rubric that the client is being scored on, can really give them direct feedback. They could use this at home to practice their conversation skills, and it's really motivating. And to add on, like, how do you take this outside of the therapy room? Actually, yesterday I went to the mall with one of my groups, and we went to one of those virtual reality experience places in the mall, and we engaged there, and then we went bowling and had dinner. But it's a way that you take from the therapy room. You're practicing a real life skill. They're not just playing a game on virtual reality, but they are engaged, and I'm seeing much more dynamic conversation than just with role play with myself or somebody else in the group. And then we're also using that to then hang out outside. So we're not just stuck in the metaverse or the virtual world. We're then having face-to-face conversations, and they see how you can use that interest to then hang out with friends.
Okay, this is probably a silly question, but I'm going to preface it by saying I'm medium old. So I'm asking this for any of the medium old SLPs out there who might be listening and aren't super familiar with what's available in virtual reality. Like, what are you actually using? Are you using like a computer that you guys are typing into? Are people wearing headsets in your office? Like, I literally don't know how to make a picture in my mind for this.
I'm using all of that. So I am using where you could just talk into the computer and the computer talks back to you. There's no visual. I'm using where there's an avatar on your computer screen and you are talking to them and they're talking back. Also using where you put on the headset and you are fully immersed and you are inside and talking to other avatars, and you could look and you're in a total different room. So you might be in the cafe, or you're at the table with your boss and you're advocating for accommodations. But in all of those scenarios, it is AI that is talking to you back and forth. What makes it therapeutic is that I have on the other end, I have control over what the scenario is, what is being measured, and how the AI chatbot is interacting. Because I don't know if you've done it, but AI chatbots are very nice and they'll keep the conversation going. So as a therapist, you can really manipulate exactly how that chatbot is reacting to the conversation so that you can target very specific skills.
All right, that's super fascinating, and you're blowing my mind a little bit.
It's so cool.
SLPs out there, definitely check out these tools that are available, because I grew up in the day of like flashcards in a tin. So it's just amazing how far some of our resources have come that we're able to use with our clients. In our last few minutes, I didn't know if you wanted to share a few parting words of wisdom or tips for an SLP who's been listening to this conversation and is now really excited to go out and either try some of these like shared goal writing, or some of these role play opportunities to work on skills for, their adulting environments.
Yes. So I want really to hit home that these clients 18 to 30, there's a really big service gap, right? They're leaving public schools where they have had a lot of explicit instruction in how to be a student. Then we kind of throw them into this adult world where we just expect them to learn these skills kind of through osmosis, and they need our help. We as speech therapists have the tools and the ability to make somebody's life independent, fulfilling, and successful. There's no better feeling than a young adult coming in and saying that they hung out with somebody outside a group and they want to come back and tell you how happy they are, or they advocated at work and they resolved a situation on their own. So being an adult is all communication, and we are the ones that can really help make sure that these neurodiverse young adults have a successful experience at being an adult, and then that they have fulfilling lives, which is our main purpose.
Deirdre, thank you so much for sharing your time with us and all of your information. I'm very inspired to go out and learn more about virtual reality. Thank you so much.
Thank you so much for having me. It was a pleasure.
Thank you so much for joining us in today's episode. As always, you can use this episode for ASHA CEUs. You can also potentially use this episode for other credits depending on the regulations of your governing body. To determine if this episode will count towards professional development in your area of study, please check in with your governing bodies, or you can go to our website, www.slpnerdcast.com. All of the references and information listed throughout the course of the episode will be listed in the show notes. And as always, if you have any questions, please email us at info@slpnerdcast.com. Thank you so much for joining us, and we hope to welcome you back here again soon.